So I'll be doing a procedure known as vulva swabbing. So vulva swabbing is a procedure that is done before catheterizing a patient. It is also done when you discover that the patient has got some discharges coming out of the vulva there. So you need to do vulva swabbing. So most of the times, this procedure it is done at labor ward. Also, there are times when you can do this procedure when you're working from female ward, where there are patients who are having maybe UTIs and other conditions. So we do that procedure, vulva swabbing, in order to prevent further infections and also to promote good hygiene. So I'm going to teach how this procedure is done within, I'm sure within 10 minutes I'll finish. So during OSC, you find the patient and you'll be given a scenario to do the procedure. It will be done in 5 minutes. So make sure you follow the steps, and once you are told to perform during OSC, you just follow the same steps and you'll be able to pass. So this one is a sterile procedure, so you maintain sterility by all costs. So first of all, I'm going to introduce everything that I have here. So I have a drip, a fenestrated drip. I also have sterile gloves here, and there are some gauze here. There's also a towel or a flannel that I'm going to use to dry my hands, and there are swabs. Underneath there is a normal saline, and there's also hand sanitizer and a receiver there. So you'll be able to see how we're going to use these things. So I'll start. Follow the steps. So first I'll do normal hand washing and I'll dry my hands. After this, I'll go to the patient. So good afternoon, Mrs. George. You introduce yourself. If you are a nurse, you say, good afternoon, Mrs. George. I'm a student nurse from, you mentioned the institution where you're coming from. I've been assigned to do vulva swabbing. I'm doing vulva swabbing in order to promote good hygiene and also to prevent further infections or prevent infections. Permission to go ahead. Do you need anything before I start performing this procedure? So the patient will tell you, okay, so the patient has said, I can go ahead. Okay, thank you very much. So I'll be back, Mrs. George. Let me just prepare everything that I need to use. So at this point, I'll put on examination gloves. During OSC, we don't expect you to start telling the examiner to say, you're going to put on examination gloves. Just put on examination gloves, don the gloves, then go to the patient. You do an assessment. So every time when you're doing any procedure, it's very important to do an assessment. So Mrs. George, I'm back. I'm going to do an assessment. Okay, so the linen is not soiled. Okay, Mrs. George, I've screened for privacy. Okay, so as you've seen, I've positioned the patient in dorsal position in order for me to do the procedure well. So I'm going to do an assessment. At this point, make sure you do an assessment. The main assessment I'm going to do, I'm going to examine the vulva. So you examine, you check. So here, there are no genital warts. I've seen there's a secretion, there's some secretions coming out. There's no inflammation, and there's no blood coming out. And there's no any foul smell, but there's a discharge that is coming out. So I'm going to perform vulva swabbing. At this point, if there's no Macintosh, you are supposed to get a Macintosh. You put a Macintosh here to prevent the linen from getting soiled. Another thing is that there are times when there's a bedpan here, you get a bedpan, make sure it's warm, you put it underneath the patient there. So that when you are, in case you pour some normal saline there, it shouldn't go straight to the linen. Then in this case, we don't have a bedpan, so I'll use this receiver, I'll put it this side. During OSC, because you've mentioned that you've screened, as you've seen there are screens here. If you mention that I've screened to ensure there is privacy, you can even leave the patient uncovered like this. Then you continue with your preparations this side. In this case, I've got an assistant, so I'll be able to cover the patient. Then when I'm done with everything, I will tell the assistant to uncover the patient and I'll continue the procedure. So Mrs. George, I'll be back. Let me just finish the preparation this side. So you wash hands after doing an assessment. After assessing the patient, wash your hands. and you dry them. During OSC, you just wash your hands and you dry them without even telling the examiner that I'll wash my hands and dry. Just do it, wash your hands. The examiner is observing whatever you're doing. The examiner is going to see everything. So there's no need of you telling the examiner that I'll wash my hands and afterwards I'll dry them. There's no need. So after washing your hands, make sure now you put everything that you need there on top. So this is normal saline. Mention the expiry date. So this is normal saline. Expiry date is 2027. So hold the label. You're supposed to pour this solution away from the label in order to prevent some spillages from spoiling where the label is. So you pour away from the label. If you have enough space, you can even move. You come here, you pour the solution like this, then back. We don't expect someone to do this. If you do this, then this bottle passes here. It means you've contaminated. So during OSC, you'll be penalized and you'll be surprised at how did I fail the exam. So it's because of these simple mistakes. So afterwards, after washing hands, I have everything that I need on top. The sterile gloves are here and the drape is there on top. So you're supposed to do sterile hand washing. So during OSC, you use hand sanitizer, you wash your hands and you dry them. Without telling the examiner that I'm going to scrub, just scrub, the examiner will be able to see. You do this up to the elbow, even this side up to the elbow. Then you get a towel or a flannel. You get it. This one has got 4 corners. First corner up to here. The other corner, you continue up to the elbow. Then you get the other corner up to here, and the other corner up to the elbow. Then you can throw this. You can bend a bit, you throw it, or you can stand here, drop it, then you do this. But you shouldn't touch the sterile field. After you've done this, you are supposed to don in these sterile gloves. So you should be careful when it comes to donning in these gloves. You're not supposed to contaminate. Then you can touch this part. Then you prepare the gauze. So you can prepare at least 6 gauze that you're going to use based on the assessment that you made. So it's very important to make an assessment. So when you're preparing these gauze, you won't even tell the examiner that I'm preparing the gauze. Just prepare without talking. So I'm talking because I'm explaining what I'm doing and I want people to know. So after you've prepared these swabs, the ones that I'm going to use for cleaning the vulva, the next thing I'm going to do is getting the drape. So I'm going to unfold the drape from the sterile field just here. After doing this, I'll ask my assistant to uncover the patient. During OSC, it means you had left the patient uncovered. You just mentioned that you've screened to ensure there's privacy. So you get the drape, you put the drape like this, you leave it. If you have 3 drapes, the ones that are not fenestrated, it means the first drape you're going to put it this side, the other one you put it here on the abdomen, and the last one, the nearest, you put it here. If you have 3 drapes, the ones that don't have this opening here. After you've done this, the next thing you're going to do, if you have a receiver here, it means you can put this in the receiver, you go to the patient. But in this case, even during your OSCE exam, you do the same thing. Get the first swab, you throw it this side. So you start cleaning. So if it is not well positioned, you can use this same hand, you position your drape well. Then you start. You can come close so that people are able to see how to clean the valve. So you start with the furthest. If I'm standing here, the furthest part is this side. So the furthest, the labia majora, this side. So you start from top, you go down like this, up to down. So you can check the swab, you observe the dirty, you discard it. So first, during OSCE, you are going to it is a commented procedure here. You talk, the examiners wants to know where are you starting from. So others will have issues to mention the left, right, so you can just say furthest labia majora. That's where you start from, the furthest side. Then you discard it. You get another one. So this hand shouldn't go back this side. If this hand comes back this side, it means you've contaminated. So this hand shouldn't go back. And when you're getting swabs from the other hand, this hand shouldn't touch the other hand. So you drop it like this. Then from the furthest now, you go to the nearest labia major. Then you discard it this side. You get another one, drop it, furthest labia minora. Then you discard. You get another one, you drop it, then you clean the nearest labia minor. Then you discard. Then you get another swab, you get another one. So at this point, sterility will be over. You get this, you hold here. Then you clean the introitus, this middle part. So I'll clean the introitus like this. No going back up, you just go down. Then you discard. Then I'll use this same one to pat dry. In case there's a solution, the one you are using is still there, you can pat dry using this same one. So you can pat dry, going down like this, you pat dry even this side. Then sterility is over. At this point, you start removing these things. During OSCE, don't wait until you are done giving IEC, then that's when you remove these things. You won't have that time. So start removing these things. Meanwhile, you're giving IEC. And make sure the patient is comfortable in bed. So the IEC that you're going to give here. So we tell the patient to avoid using herbs, inserting herbs in the vagina, and also not to be inserting fingers because they might introduce infections. Also emphasize on taking medication on time, and also to make sure that if they are not feeling well, they have any condition, they can still come back to the facility. So most important, depending the scenario that you are given, make sure you give IEC related to the condition that you are dealing with. So you won't just stand, you continue. After you're done giving your IEC, you are going to wash your hands, and you dry your hands after giving IEC. During OSCE, mention that I'll document and report to the ward in charge. So thank you very much, Mrs. George. I'm done with the procedure. You give the IEC the points that I've talked about. So thank you. Make sure you take care of yourself. All those points, state them. If the patient is comfortable like this, then you can document and report. If the patient has got any questions, they ask you questions, make sure you answer those questions. Don't